Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 4-year-old male castrated lab with intermittent hind limb lameness. Based on your orthopedic exam and the clinical history, you decide to screen the hips using the traditional ventrodorsal hip extended view. Last week we talked about some of the features of this view that contribute to good radiographic positioning. I'll give you a moment to look at the zoomed out view to assess the radiographic technique. Well, it's pretty good, isn't it? The femurs are essentially parallel. The patella are relatively centered, although not perfectly so. We can see symmetry of the ilium, the ischium, and of the obturator foramen. So this radiograph is of very good quality to assess the hip status. When I'm ready to look at the hips within my ABCDs routine, I then go into assessing the 3 main points for hips: coverage, congruity, and degenerative changes. Let's start with coverage. Coverage refers to how much of the femoral head is within the acetabular cup. On this side, you can see that essentially only a whiff of the femoral head, and certainly well less than 50%, is covered by the acetabular margin. On this side, it's a very similar status. That's how I assess coverage. In this instance, I would say the coverage is poor, which tells me that there is subluxation of the hips, that the ball of the femoral head is not within a socket of the acetabular cup. After coverage, I look for congruity. Congruity is that sense of, is the shape of the femoral head matching the shape of the contour of the acetabular cup? Well, as you can see, the femoral head is very sort of blunted, and the acetabular cup, it really barely qualifies as being rounded. It's almost flattened. So in this case, our congruity is also very poor. Another way that I look at congruity is I look at the radiographic joint space, and you can see that it's not uniform, and in fact you could even argue that it gets quite narrow in some places. The third thing that we look for are degenerative changes, and I like this case to sort of get in a little bit of detail about what we look for when we're looking at degenerative changes of the hip. I'm going to zoom in, and let's use the left hip. The first thing that I would say, to be very general, is that there is a large amount of periarticular new bone formation. When I say that, I'm simply referring to the fact that I see new bone formation on all different parts of the joint. From there, we can be more specific. We don't always have to be, but sometimes it's useful. The 2 main types of periarticular new bone formation that I might want to be specific about are called osteophyte and enthesiophyte. Definition of osteophyte is new bone formation at a bone cartilage junction. An example of that would be new bone formation right at the edge of the femoral head. The femoral head is the edge of the cartilage, so this is a bone cartilage junction. An example of enthesiophyte would be new bone formation at a soft tissue insertion. An example of that is shown here. This curvilinear line has been referred to as Morgan's line and has been associated with enthesiophyte at the insertion of the joint capsule on the femoral neck. So although we don't need to be super specific when we have this substantial of degenerative changes, it's a nice example of the difference between osteophyte and enthesiophyte. There are some places where we could use both terms. So for example, on the edge of the hip here, although this is a bone cartilage junction, there also are some joint capsule attachments on the acetabular margin. So osteophyte and enthesiophyte can be used specifically where possible, and in other cases, the term periarticular new bone formation is more than sufficient. So I would conclude for this case, unfortunately, that we're dealing with severe canine hip dysplasia with secondary degenerative joint disease. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.